Hey guys, this is Dr. Leslie again for myology, kinesiology, and any of the other ologies I talk that or teach. You may be having me with any of the health sciences. I've been doing some videos, as this may not be the first one you're watching, in regards to reviewing some of the main landmarks through the osteology of the body. If you haven't watched the other ones, you know, the usual thing I discuss is this should only supplement your PowerPoints and other notes I handed to you. I may not cover 100% of the items from your notes, but for the most part, I try to cover everything. But if I do miss it, I do want to try to do this in a non-robotic fashion as much as we can. So definitely review that. And I will try to, I've been getting suggestions on trying to improve these. Keep in mind, I'm doing kind of low tech right now. If I find that these become more valuable, and I plan on doing a lot of other videos for surface anatomy, etc., and I update the technology, I'll let you know. Okay, or at least update and improve on these videos, I'll let you know. Okay, so the next thing we're going to talk about is the knee. All right, we are looking at the anterior portion of the left knee. All right, now I'm not going to zoom all the way out, okay, but if you were to continue where my pen is up all the way up, you get to the femoral acetabulum joint, and kind of where the pen is marking would be kind of the medial side, or pointing in that direction towards the medial side of the area. So, you know, when you review your adductor muscles, this is going to be the medial side of the leg and knee. That's going to be the lateral side. Okay. So again, we're looking at the distal portion of the femur. On the medial side, a couple of landmarks is we're going to have the adductor tubercle, attachment of the adductor magnus. I'm looking at my camera. Adductor magnus is going to be coming on this side of the adductor tubercle. We're going to have the medial epicondyle. We're going to have the lateral epicondyle, which I was over before I picked up my mistake. Here's our patella. Again, that's going to be a sesamoid bone, okay, floating within what? The quadricep muscle group. Okay? We have sesamoid bones where? In our thumb and in our big toe, correct? So this is going to be the base of the patella. We're going to have the apex of the patella. So it almost looks like a guitar pick. Now remember, the undersurface of the patella, you know, obviously this is a model knee, so it's going to be attached right now, but these are going to be floating, and depending on when we extend or flex the knee, it's going to ride up in the intercondylar groove of the femur. And in kinesiology, we talk about patellofemoral tracking syndrome. A lot of times there's weakness of the vastus medialis on the medial side and a dominance of the vastus lateralis on the lateral side, pulling the patella laterally and causing some friction. But we'll talk more about that in the lecture portion of the class. Okay. As we kind of continue down, we're going to have the tibial tuberosity, which is going to be the attachment of the quadricep muscle group. Okay, rectus femoris, vastus lateralis, medialis, and intermedius. Okay, and it's going to pull on that area and cause knee extension. Okay, we're going to have the tibial crest. I may have to get away from the pencil for a second, but let me just try to move this around here. We'll have the tibial crest, kind of the ridge and groove here. As we look inside, I'm going to take a look. We're going to see the condyles of the femur. Okay, I'm going to try to bear with me here. I'll try to get this perfect for you guys. Here's going to be the lateral condyle. Okay, those are the big surfaces of the femur, and that's going to be the medial condyle. Okay, which are going to meet. The medial condyle is going to meet the medial tibial plateau, and the lateral condyle of the femur is going to meet the lateral condyle of the tibia. All right. One thing we're going to kind of take a look at, okay, I'm just going to kind of move. You see those roughened surfaces coming up there on the tibia, on the lower portion of your screen where the metal bar is running in there. Those are going to be eminences, okay, for attachment of the anterior and posterior cruciate ligaments. Right? The anterior cruciate ligament is going to attach on the anterior side of the tibia. The posterior cruciate ligament is going to attach on the posterior aspect of the tibia. So the ACL is going to run from pretty much the lateral condyle across to the front, and then we're going to have, I'm trying to get this video for you, I don't have an assistant here doing this with me, so I'm trying to get the angle proper. I wish I had 4 hands. And then you're going to have the PCL running from the medial side to the posterior aspect of the tibia. Now remember, the ACL is going to keep the tibia from translating anterior. We talked about an athlete getting a blow from the back of the tibia, moving the tibia anterior, and that could tear the ACL. And the posterior cruciate ligament is going to keep the tibia from going posterior down into the table, okay, which it doesn't have to be athletes. It can be a driver in a car and their lower leg hits the dashboard. The lateral collateral ligament is going to be on the lateral side of the knee, approximately right here. I always like to consider ligaments kind of like the duct tape of the body, tries to hold, goes from bone to bone. Okay. We also call the lateral collateral ligament, which would be about right here, the fibular collateral ligament, because we haven't covered this yet, but this is the fibula. This is going to be the head of the fibula. All right. We'll learn one of the hamstring muscles. There's 3 of them. Okay. We have the biceps femoris that's going to come down and attach to the fibular head. So if you're palpating your own knee right now and you're on the lateral, the outside portion, you may actually feel a band, okay, running to this landmark, which is your tendon of your biceps femoris. A little bit anterior to that, you may feel the IT band coming down. And it goes past the tubercle, Gertie's tubercle. They can get some friction. We talked about a little bit about IT band syndrome in the hip unit, the hip video. So the medial side of the knee is going to have the medial collateral ligament, okay? And that's going to attach, also be called the tibial collateral ligament, and it's going to go from the proximal medial femur to the lateral medial tibial area. And people have joint line pain, they'll have pain there. And you know, what commonly we talked about the tearing of the ACL and the PCL, a valgus stress, kind of like what I'm doing to the knee right now, like a force going from the outside, will gap open the medial side of the knee, have a propensity to tear the MCL, and then vice versa, okay? A blow from the medial side of the knee will stretch out the lateral side. And we cover all this in the lecture notes, okay? Other things worth noting is this area here, the anterior medial side of the tibia, okay, is the pes anserine area. Remember, we say grace before T. The sartorius coming off the ASIS is going to come down and fan out and attach here with a common tendon. Gracilis off the pubic bone. One of the adductor muscles on the medial side is going to come down and attach there. And then the T is semitendinosus, one of the hamstring muscles that are going to attach there. So we have a hamstring going to the lateral side of the knee. We got the semitendinosus hamstring coming through the posterior side, coming here to the pes anserine area, and then the other hamstring muscle coming to the posterior side, more on the medial side of the knee, okay, attaching there. What I want to do before we end this video, okay, is when I open up the knee joint and we take a look again, all right, we're going to see those intertubercular, okay, eminences, okay, right in there. We also, that surface of the tibia is where the 2 pieces of cartilage, fibrocartilage to the knee joint is going to be. And very commonly, why I try to bring it up in the knee unit, is that those can tear commonly. And they'll get joint line pain walking up steps, popping, clicking in the knee. You know, they don't have to have all those symptoms, but it can occur. If I go to the posterior side of the knee, okay, all right, we kind of take this, let me just slide us up here a little bit, and let me just fan out again. I'm working with, let me get a little bit of the table here, but that's okay. So again, what we're looking at is the lateral condyle got really separated. So we almost got like a dislocation in the knee. Here are those prominent eminences on the tibial plateau for the ligaments. Okay, here's the medial condyle. It's going to be the popliteal fossa area, right? That's the back of the knee. So the hamstrings are coming down the back side. So again, like I did with the hip unit, is if you don't see the patella, right? You don't see the patella here. So we're looking posteriorly. So if you see muscles especially you get the one-dimensional muscles when we test you on it. If you don't see the patella, we know we're looking posteriorly. So most likely we're going to be in the hamstring group. Okay. Gastrocnemius, okay, is going to attach up in this area behind the knee. Remember, that crosses the knee and the ankle joint, and soleus is going to be behind the knee. Okay, excuse me, behind the tibia. And here's our fibular head again. So again, guys, hopefully that was helpful. This is mainly the knee. Again, please cross-reference this with your notes. I try to be as thorough as possible. There may be a few landmarks I am overlooking right now, but again, please supplement this with your notes. Have a great day. Take care.